Good evening, all. I, Dr. M. Vijay Karthikeyan, National Treasurer of IAME, feel very much privileged to welcome each one of you join for today's panel discussion, organized as a monthly event from the IAME. And we are now moving on to various subject-specific topics for the past two events. And today also we have a very interesting topic, and we have with us four eminent panelists and moderator who will be sharing their insights on the topic neuroplasticity in learning. And all neuroplasticity in learning, brain inspires adaptive teaching. So before going into the proper panel discussion, I will just want to have a small announcement from the side of IAME. IAME is now a registered association under the able guidance of our President, Dr. Pragnesh Paramar sir, and also our founding General Secretary, Dr. Kribakaran sir, and our Vice President, Ghulam Mohammed Bhatt sir, and all the efforts from the EC members, we were able to achieve this important milestone. And for any collaboration for workshops or any conferences, you are all welcome to collaborate. We are open for collaboration. And first collaboration for us is for the national conference Deepam Medukon, which will be conducted in Tiruvannamalai district of Tamil Nadu. And for the members of IAME, we will be soon starting the membership drive. But for now, we have a WhatsApp group, and the members in the WhatsApp group can avail a special registration fee in this Deepa Medicon conference. So kindly contact any of the core team of IAME for any further collaborations and events in the future. So now, with no further ado, we will move on to the introduction of our moderator. So we have with us our very own IAME West Zone Secretary, Dr. Trupti Borulkar ma'am. She has done her MBBS, DCH and MD in Physiology. And also to her credit, she has completed various postgraduates diploma. And she has completed her PhD, also ACME and MHPE. And she is currently the Associate Professor and pediatric consultant at Symbiosis Medical College for Women, Pune. And she has a vast experience of 25 years in teaching and treating child and adolescent cases. And also, she has been entitled with various administrative roles in her institution, and also managing hospital and medical college operations to ensure high standards of patient care and health education. She also has published 6 medical books and 6 literature books. And she is a public health advocate, conducting various social activities and also programs such as workshops, seminars, and lectures, mainly focusing on women and child health, and also mental health is also her domain. And she is also the founder of Health Edu Catalyst, guiding health institutions towards excellence. And her core focus is dedicated to improving health education systems, ensuring quality care, and mentoring future medical professionals. With this small introduction, I would now like to hand over the forum to the moderator. Trupti ma'am, you can kindly take over from here.
Yeah. Good evening, all, and thank you, Dr. Vijay, for kind introduction. So, good evening. Specific, that is physiology, IAME panel discussion on neuroplasticity. Brain inspires adaptive teaching. Physiology, neuroscience, pedagogy, psychology, and AI. Does the brain really learn, and how should this shape medical? We often say structure determines function, but the brain is unique. Its function, or mostly function, can reshape structure. So every time engage, recall, or even productively, we see some measurable changes in brain circuits and cortical networking. Tonight, we explore how teachers and students use this biology to design better learning, better habits, and better outcomes. So let me introduce our esteemed panelist, Dr. Chinmay Shah, sir. So everybody from physiology background knows him. So he is a professor of college, Bhavnagar, Gujarat. His PhD in physiology and his areas of so physiology education, CBME, medical education technology, different assessment, cardiovascular, autonomic physiology, research and scientific writing, quality assurance, being dean of college. He is into quality like NABH, EC accreditation or and all. Vijay, next slide. Sir has vast CV of 48 pages. So we have
I think we can cut short the introduction. Thank you very much, Dr. Trupti. Thank you very much, IAME,
yes.
for giving this opportunity. Thank you very much.
To mention few awards and recognition, he is a fellow of College of Chest Physiology, expert member of NMC, MD Physiology Curriculum Revision, then Executive Task Force member of NBE. He has played various roles at the national for NABH and Ethics Committee Accreditation and QAS, and officers on special MER, Gujarat, National Resource Person for MEU, GCP, Research Methodology and E-Learning. Research publication to his name and 7 books authored, 18 book chapters contributed. So we have such a esteemed panelist today evening. Next slide, please. Our next speaker is Dr. Munira, who is related with physiology and medical education, knows her education college and MBBS also from same college. She is a GSMC famous teacher also. So she has been in various leadership and key roles like associate director of, then co-convener of medical education unit, KEM Nodal Center, AHP, and member MCI expert group for ECE, and member MUHS task force printing. So her areas of expertise are feedback and reflection, experiential learning, curriculum planning, program management and evaluation, work-based assessment, publication and authorship. She has and medical students and essential skills for postgraduate dentistry, multiple publication and health profession education. Our next panel, Dr. Vijay. Yeah. Pradip Barde. He's a famous fellow and professor physiology at AIMS Rajkot, Gujarat. He has completed MD physiology and he's a Maharashtra candidate for UG. Awards and roles are patent holder, medical device innovation, developer of high altitude non-invasive cardiac output monitor, IC Associate Dean, Welfare at AIMS Rajkot, officiating Deputy Director Administration at AIMS, an invited speaker at on AI, medical instrumentation and education. Research his name, funded projects, DBT and ICMR and AIMS intramural grants, and multiple. 20 years, 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 completed medical education research. Our fourth panelist is Arunima Chaudhuri ma'am. She is a professor and head Department of Physiology Affair at Burdwan Medical College, and she has completed she's MHP Gold Medalist, FEMER Fellow, and PDCR, that is Postgraduate in Clinical is Community Mental Health, Postgraduate Diploma in Bioethics and Health Law, IAME, that is Skills in Medical Education from IAME Dundee. And adjunct faculty, Institute of Health Professions Education, Purchase. So her research publication 180, presentation 36, and chapters contributed in books 5. So panelist today. So let me start with the intro. One of the biggest miss going in.
Madam, your
Physiology,
voice is breaking.
we know it's.
Madam, your voice is breaking.
Yeah,
We can't hear.
Now, is it okay?
Okay.
So in physiology, we repeated activation, stronger firing, long-term potentiation, consolidation, and then long-term do not belong only to laboratories, but belong to. So today's discussion will help us to understand what happens, how teaching methods influences synaptic learning, stress, emotions, and motivation alter neuronal efficiency, how daily networks, and how AI neuroplasticity. So let's begin. First question is to Dr. Chinmay sir. Sir, learning is usually described as input or information being absorbed. Yet neuroscience physiology happening in the brain when learning is occurring. Can you explain plasticity in medical
Sure.
learning? Over to you, sir.
Yeah. Thank you very much, Dr. Trupti, for starting with a very basic thing of learning. So as you rightly said, that learning is actually far more than the simple input or absorption. And if I divide your question into two parts, the first part is the physiological process of learning, what happens when students participate. So as we all are physiologists, we all are aware that if in a one line, if I were to say, I can say that the neurons that fire together wire together. So now during all this process, as we all know, that there are few key physiological events take place when learning is going on. So number one is a synaptic activity, which is there when the communication between different synapses are happening when we learn. Secondly, uh, as you have briefly mentioned, that there are two important aspects happening. One is long-term potentiation, and second is synaptic curing and long-term depression. If we further go into the little depth of long-term potentiation, the strengthening happens for the long-term memory, and there are few changes take place like increased receptor. There are certain structural changes like more and more development of dendritic spines and increased neurotransmitter release. Similarly, if we look at the long-term depression, then connections which are rarely used are weakened and eventually eliminated. So based on the need and based on the process and based on the experience, either long-term potentiation or long-term depression happens when we learn. That was the first part of your question. Secondly, you asked that how can we express neuroplasticity in simple terms? Let's consider that our brain is one big city, and learning happens when something is going on. We build new road, new bridges, new buildings, and everything. Now, what is the neuroplasticity? In simple term, neuroplasticity is our city's ability or our brain's ability to constantly keep changing, or in the same term, if we say constantly hiring a new construction worker to build a new road, widen the existing highway, tear down the unused dirt, and all the different changes. So when we use this word for specifically medical education, let me give an example that when student uh, repeatedly practice taking a history or reviewing anatomical structure, they are physically building and solidifying the neural pathway that encodes the knowledge and skill. And this we can consider as a structural plasticity, or in our computer term, we can say changing the hardware. And similarly, when student moves from memorization to sophisticated diagnostic reasoning, as we go into our pyramid and the higher level of cognition, it means that functional plasticity is taking place. So ultimately, because of that, same thing we can explain for the procedural skill, that when we go and in higher level of cognition, higher level of procedural skill, the repetition will increase the, which will leads to more and more plasticity, and uh, more and more center will develop and student will learn better. Just to summarize, if we can say that it is a consistent, deliberate practice and high quality exposure by repetition and intensity are the actual tool that leads to neuroplasticity to transform a student's brain into expert physician. So this is whole we have tried to comprise from learning to neuroplasticity in medical education. I hope this answers your all the different questions.
Thank you. So you rightly mentioned the repetition or practice makes neuroplasticity or neuronal connection more. In line with this, I want to ask Dr. Ma'am, so synaptic strengthening requires repetition, feedback, spaced activity, and so I have two questions for you. The first question is, can evidence-based teaching simulate the neural mechanism for this, especially in medical? Over to you, ma'am.
Okay, so I think first of all, good evening, everyone, all those who are present here, and thank you, Dr. Trupti, and the organizers, the IAME, for giving me this opportunity. I'm just repeating your question just to be on the same page with you. You're asking me about repetition, feedback, spaced activation, and active participation in medical education and evidence-based strategies for the same, right? So let me go ahead. So when we talk of repetition, we are actually looking at, now I'm trying to link what Madam has asked me to what Dr. Chinmay Shah has told us about memory and learning and the basic neuroscience about it. So repetition is going to help in long-term potentiation. Feedback is going to correct the errors and prune the circuits which are non-functional or incorrect. Spaced activation will also help in consolidation and conversion of recent memory to the long-term memory. Active participation will help in engaging more cortical networks and help in deeper processing. So, considering all this, the practices that we can use in our classrooms are, the most important one is the retrieval practice, which is the most powerful brain stimulator and stimulator of neuroplasticity. So it works because every time a learner retrieves some information, it pulls out that information from the long-term memory to the working memory. And if feedback is given simultaneously, it's going to help in strengthening the correct pathways and the synapses. So we can use a retrieval practice like by testing. Testing is one good way for retrieval. And what is important is to use more of free recall type of questions, short answer questions, rather than something like an MCQ, which requires only less kind of inputs. If we are using MCQ, then there need to be something like a key feature question where there is lot of various levels of knowledge which are recalled and some reasoning which is there. So like if you are looking at, it's like a warm up, even if before you start your session in your classroom, you could have a retrieval practice where you are asking some questions and maybe using that to build upon and bridge to the new knowledge that we are going to activate. In this, spaced repetition is very important, and I think our students are aware of spaced repetition. There are many apps which are using and helping the students for this, and Anki is one app. What spaced repetition does is it actually causes consolidation and it causes reconsolidation. So when you pull up the information from long-term memory and try to retrieve it, and then it is reinforced and reconsolidated. So it makes the memory trace stronger. It also helps in developing mastery over the subject or the skill that would be in consideration. Then I think Chinmay also spoke about deliberate practice. And this is a core component of CBME. When I talk of deliberate practice, it's not just repeating something. What we actually mean is it's something focused task, small chunks, followed by immediate feedback and correction. So you are using something called as chunking, using small bits of learning and repetition, which is focused, and the feedback is going to help, the immediate feedback is going to help you in strengthening that learning to make it long term. So, for example, any clinical skill that you're doing, and as we know in physiology, we have certifiable skills, maybe we could use that, or even for the theoretical skills, like you have interpretation of the ABG reports, that could also follow this kind of practice. This feedback has to be immediate and quite specific. Only then it is useful. I think Madam also asked me about active participation. I think peer instruction is one way in which we can achieve this. So there are various things that we could do, and I think the commonest that we all are aware of and have been following is something which we call as think, pair, share when we do. So when you are posing a conceptual questions, students can think about it alone and also discuss in pairs and come up with the answer. So say like you have a conceptual question like how does preload affect the force of contraction? So when you ask such kind of questions, it prompts the student to think about the concepts, and that is going to deepen the learning and also the retrieval later on. When you're talking about test formats, I already mentioned that we are not looking at just recall, but we are looking at creating or constructing the knowledge so that it can lead to long-term retrieval also. There are many other things that I would like to share with you. Dr. Trupti, shall I go ahead? Do I have the time?
You can. You can share your best learning strategy or teaching strategy.
So, okay,
Physiology. So
let
the
me share.
fellow, yeah.
Let me share when we are actually looking at planning a session, how we can move from content delivery to designing a learning experience. And maybe I would just like to put it in the form of a few tips that we can use. So there are three parts to learning and memory. One is encoding, one is consolidation, and one is retrieval. So when you're planning your session, you think about what you want to achieve. Encoding can be achieved by various ways. One tip is to reduce the cognitive load. There is something called as the cognitive load theory. If the cognitive load is more, or there is something which is extraneous load, that means there are some disturbances, some other material which is unrelated, then learning becomes less. So your task is to focus on the cognitive load. Our working memory has a limited capacity. So looking at the capacity of the working memory, break the contents into small pieces and only few concepts at a time. Then use something called as dual encoding, which we all do. We always use some image and we also talk simultaneously. But remember, if there is lot of material on the slides, then again the processing becomes very slow. And what we want to do is we want to use both of them together so that it enhances the working memory. There is a limit to working memory for visual, limit to the auditory pathways, but when we use both simultaneously, we can expand our working memory and hence the encoding. We have to work to help the students build the mental models or what we call as schema. So this can be done by bridging. It can also be done by something called as scaffolding. So what do you mean by scaffolding? Scaffolding is nothing but support that you offer to a student. Like we have scenario-based questions. We expect the student to come up with the responses. But maybe a first MBBS student may not be that skilled or may not have that requisite level of knowledge. So what we need to do is provide some support, provide some cues, and slowly over time, withdraw or fade away those cues. So that is something that we can do. One more thing that I am very fond of is illness scripts. Now, we must wonder, like, in first MBBS, how many illness scripts can you do? But I'll just give you one example. We all, jaundice is a very important topic. We always classify and help the students. There is usually a case also, whether it is pre-hepatic, hepatic, or post-hepatic or obstructive jaundice. There are so many different features. If we put all of this in a tabular form, like what is the pathophysiology, what would be the presenting complaints, what would be the characteristic signs or symptoms, where itching is present, what would be the color of urine, what would be the color of the stools. So if we help them organize this information, encoding will be better. So you can use such kind of tables, differentiation, or scripts to help them. We also use stories, we also use patient cases. What that does is it's called as emotional cueing. So we are activating the amygdala, and that also helps in stronger encoding. If I'm looking at consolidation, I can do something called as using a spiral type of a curriculum where I build slowly upon previously already dealt with knowledge. So in case I have, say for example, ECG, we have already talked about the normal waves. Then maybe in the next session, we could revisit this and use it as a bridge to add in some more knowledge about maybe the axis or maybe some arrhythmias. And of course, we've already spoken about feedback. We have something for retrieval. Retrieval, what we can do is there is a retrieval practice. And remember, whenever we are doing retrieval, either with tests, the effort has to be much more than just a recall. So it is effortful recall that is more important, and that is the strongest method. And spaced repetition, I can just add something here for spaced repetition. There is some SM2 algorithm is there, which is commonly used in many of the apps. It decides based on the various things like easiness factor of that question, how many times you have answered it correctly, and it decides how frequently you should repeat that particular question or that content knowledge. So that helps you automatically to set up the repetitions. Of course, you could also do with the other algorithms which are available. I think there's something called as 257, 2357. So you could space it at this level. The latter repetitions are spaced with more intervals. And this is what is important for having long-term potentiation. Two things more that I would like to share is what is more now people enjoy is the gamification. So when I'm talking of gamification, there is some reward, there is some competition, there is some collaboration, students work together. So when I'm talking of gamification, we have so many free apps, and we have also in your LMS, you could integrate some plugins. So we have Kahoot, we have these small quizzes that you could conduct, and that is going to help students retrieve that knowledge. Last thing that I want to share here is all our students are using these parallel curriculums. They are having Marrow, they are having dams, online things. So when they are already using that, they might be using YouTube, some osmosis app, whatever. That is there to stay. We cannot help that. What we can do is use the good points in that curriculum or the way it is delivered. There is always spaced repetition, there is always tests. Let's use that along with us. Maybe with the students, we can co-create some material for which can be used for retrieval. So I think that is something that we can do. We can say create flashcards with the students. Most of our LMSs do permit small tests. So I think co-creating content is very important. Right now, I think that's all I have to say. And I can see a question in the chat with I
Yeah.
think
The question is
sleep in consolidation.
Hmm.
I think is Dr. Pradip going to address that question later on?
Yes.
Okay, so we'll hold on
with
for
your
that.
yeah. Thank you, Munira ma'am. With medical education, you have thrown light on how we can make the teaching experience.
We are not able to hear you, madam.
Dr. Vijay, we will go for a quick poll for the audience. So, audience, please have a we can end. That's it will give. Yeah. So case listening, most of have for that. So yes, rightly. So when we correlate to the best is a problem solving, maybe critical thinking, and all factors will be in. The student learn better from the case-based reasoning questions. And our participants for this. And coming to the next question. So I would like to ask first Dr. Pradip sir. So students truly understand how is the info.
Trupti, madam, we are not able to hear you.
So do students truly understand?
Yes, madam, I got it.
Encodes, stores, and retrieves information. Should
Yeah.
learning physiology formally taught just like any other system in physiology? If your answer is yes, so
Yes, yes. For benefit of again all, I will just repeat the question. That is, it is something related to understanding how our brain or neural system works and encodes and stores and retrieves memory. So, if we understand this, how it happens, can we use it, or in young generations' words, we can say, can we hack this knowledge or use it as a hack to learn more nicely? So yes, definitely. If we see, and I'm going to talk it later on in detail, but now I must say that all component of the plasticity are affected by the information processing, storage, and its retrieval. If we, as a student, you start them telling this from the first year itself, though the nervous system by protocol or by tradition comes in second half, but even in first half also what is related for memory storage, or we say the efficient way of learning and understanding, then partly you can explain them to motivate them that yes, these are the ways in which definitely it will be helpful for you to understand and retrieve the vast subject of medicine, because by the time they purchase the book for first year and get idea from the seniors about the kind of content, or even in foundation course or in some places what is called as orientation sessions, so all they tell us and tell them, everybody is telling बहुत पढ़ना है बेटा, you have to read a lot, medicine is vast subject and all. So then they get, maybe like few of them get frightened by this ki am I able to do it, will I be able to complete it in proper way, or they have their other drawbacks in the beginning. Some people have language barriers, some have other adjusting barriers, and within that this much cognitive load, as Dr. Munira rightly said, as information also, not on the slide, but everybody talks about the saying that you have a lot of cognitive load to do, and within that then there are sessions that how to study efficiently. So this how to study efficiently only talk about this only, that how to use the knowledge of the our memory or learning or the retrieval, I mean the part of memory only. So how it will be helpful for them to study efficiently. So yes, it is required to tell them that this plasticity and the whole basis of learning new things, and then like a role of sleep, as one of the question has come up. So again, we'll discuss in detail, but shortly, in a way, we always teach student about sleep hygiene and importance of good sleep, and everybody is talking about it. So yes, it is very important in memory consolidation for the short-term memory to go to long-term memory, and how it happens. That if we tell them that yes, if you want to perform, because what we say performance or assessment drives learning. So if you tell them कि आप एग्जाम में याद करना है या वाइवा में क्वेश्चन आपको याद आना है या एग्जाम में आपको लिखना है, then definitely what will be needed is right recall, and right recall will not happen with right consolidation. That doesn't occur, and for which you need to have good sleep. Similarly, we can talk them about nutrition and so on and so forth. So I think that answered your question as of now. Thank you.
Yes, yes. Thank you, sir. Thank you. Doctor, can you share your views on this?
You are asking me, ma'am? Ma'am, are you asking me?
Yes, yes, yes.
Okay, from a psychological perspective, teaching students about their own learning process enhances metacognitive awareness, the ability to monitor and regulate one's own thinking. When students understand that forgetting is normal and that struggle indicates growth, they develop healthier relationship with learning. They become less anxious about not understanding something immediately and more strategic in their approach. Learning must be a pleasure, not a pain. Teachers must be facilitators, not fault finders. Learners must be immersive, not distracted. Atmosphere should be conducive, not toxic, so that parting at the end must bring a tear to all eyes, not a sly smile or a sigh of relief. Team is more important than individual. Feedback is not criticism, but a stimulus for improvement. No one can know everything, and there is no shame in saying that I don't know. That's from my part. Thank you.
Thank you, ma'am. Dr. Munira, can you please just quickly share how, like, should we teach learning physiology?
To medical students, it's a part of their curriculum.
But specifically, we should stress.
So the only thing is that we have to move and focus on the applied aspects.
Yes.
It is something that will interest them because it is directly applicable and useful and relevant to them. So I'm sure that once I think the thing that we have to do is we have to just move to the applied aspects. So whatever we are teaching them about the different types of memory and how we can harness, or as Pradip sir said, hack what we know to our benefit. So I'm sure they're going to learn, and teaching them is mandatory. And I'm just going to move it to the applied aspects. I think it should be done. Thank you.
Like more connected with the what they are learning. Other sometimes some students say they are not very happy to learn that in depth, but when we connect with thing, they feel really good about that. Doctor, can you some points or some of your opinion? Yes.
Hello.
Yes, you are
Uh,
audible.
yeah. The thing is, as Dr. Munira has rightly said, and whatever we have discussed, the thing is now it's time for all our educator to use this mechanism in training in such a way. See, now students are going through the reels and small videos and everything day in and day out. And if you look at it, their capacity to learn or to see the different videos and different activity has been reduced less than a minute. Initially, we were talking and telling that our capacity is 20 minutes. But now we have to use all the different mechanisms or different, we can say, gaming, offline gaming also, not only online gaming. But again, because there also, again, it comes that their attention span is reduced. So that we all have to use to teach student a subject in a way that they remember. And rightly said by Mundira madam, let's see, now maximum before NEET also, they learn most of the physiology. And for physiology also, they are looking at the videos and Khan Academy and Nazib's and all different lectures. We accept or not, but it is a reality that they are looking beyond the classroom and they are learning different things. So here it is now our turn to take over a flipped classroom and use in more and more applied things discussing. So when they are discussing, they will think, and once they will start thinking a different aspect, their memory will increase and their learning will increase. So now it's I think it's our time to move on to a flipped classroom from the traditional classroom and use a technique which will help them to memorize more and more things in a more gamified manner or more engaged and manner in which they are engaged with the teaching.
Now, my next question is to Arunima ma'am. So, safety play a very big role, important role in learning. So, emotions modulate neurotransmitter, the activities, neuronal act. How do emotional safety, intrinsic motivation, or hormones like stress tips a teacher can to really supportive learning environment? So, ma'am, please. Over to you, ma'am.
Yes, ma'am. The connection between emotion and learning is neurobiological. When students feel unsafe, whether from harsh criticism, social exclusion, or unpredictable environments, the amygdala activates a threat response and fundamentally alters brain function. Not all stress is detrimental. Moderate, time-limited challenges produce an optimal cortisol response that actually enhances attention and consolidation, what researchers call as eustress. However, chronic and severe procedures sustain cortisol elevation that becomes neurotoxic, particularly to the hippocampus. This impairs not just immediate learning, but the brain's capacity for future plasticity. The key distinction is controllable challenge, which students can navigate with support, enhances neuroplasticity, while uncontrollable threat, which overwhelms coping strategies, degrades it. Elevated cortisol level don't create discomfort. They actively impair don't just create discomfort, they actively impair the hippocampus, critical for memory consolidation, and reduce prefrontal cortex efficiency. The prefrontal cortex is essential for executive functions like planning and self-regulation. This creates a physiological state incompatible with learning. Neural resources redirect towards survival rather than growth. This is why anxious students during oral examinations might forget even basic concepts they know well. Their brains have literally shifted into a different operating mode. Conversely, emotional safety down-regulates the stress response, allowing the prefrontal cortex to operate optimally. The brain can then engage in an explanatory trial and error process necessary for neuroplastic change. Think of safety as removing the neurological parking brake. Learning mechanisms can't function efficiently when the system is primed for threat. Intrinsic motivation activates dopaminergic reward circuits, particularly in the ventral tegmental area and nucleus accumbens. Dopamine doesn't just signal pleasure, it's a neuromodulator that enhances synaptic plasticity by facilitating long-term potentiation, LTP, the cellular mechanism underlying learning and memory. When students find tasks meaningful or enjoyable, dopamine release strengthens the neuronal connection being formed during the activity. This explains why forced, extrinsically motivated learning often produces shallow encoding. Without dopaminergic enhancement, synaptic changes are weaker and more transient. The brain literally learns better when it cares about what it's learning. So, practical actions for teachers start with psychological safety. Begin classes by normalizing mistakes. Say explicitly, errors are expected and valuable. When a student gives a wrong answer, respond with, "That's interesting. Let's think about why," instead of harsh correction. This simply reduces the amygdala activation, provide autonomy, give students choices, which case to discuss, which topic to explore deeper, or how to demonstrate understanding. Choices increase motivation and engagement. Connect to meaning instead of starting with, "Today we will learn about the cranial nerves." Start with, "By the end of the today's session, you will be able to diagnose Bell's palsy and understand why it happens." Purpose activates motivational circuits. Use pre-learning questions. Before introducing new content, ask students what they are curious about. This primes the brain for learning and activates prior knowledge networks. Build in reflection time. End sessions with 2 to 3 minutes for students to write what they learned and what questions remain. This consolidation period is crucial for memory formation. Acknowledge effort and not just achievement. Praise strategies and persistence, not innate ability. This builds growing mindset and reduces anxiety about being smart enough. Thank you.
About psychological safety and its importance. Next question is to Dr. Pradip sir. how as a teacher we can suggest or teach or lifestyle to take responsibility of their own learning. So what daily habits like study routines, sleep hygiene, support synaptic plasticity and memory consolidation and cognitive points?
Yes, yes. So that is very important. So far we are discussing mainly on the teacher's part, and partly definitely what we can impart, and the stakeholder is ultimately student only, though we are discussing on the teacher's side. But as a student, what we should tell them, so that that will support or utilize the synaptic plasticity, memory consolidation and cognitive performance. So we'll go one by one. If you talk about study routine, I think much has been conveyed before, but students should also understand it, and we should highlight its importance in the initial sessions only. Like we should not wait CNS system for the telling these things. So in the beginning only, we should tell them about spaced and retrieval based studies, like short and repeated session with self testing to repeatedly activate and strength task relevant synapses and support long term potentiation and system level consolidation. So this study routine they can definitely use within this, and other methods which will help them in this better consolidation of memory and better learning. What is we are talking about what they should do, but when you talk about sleep, very important as a student life or even as a teachers for us now, or everybody for that matter, common man also, that we are finding less and less time to go to bed and have nice sleep. So how it works for the memory, that a student should know that avoiding chronic sleep restriction and continuous multitasking, that is one thing that we all are doing, and now also a lot of people are doing while listening this lecture also. So continuous multitasking during study, that increases physiologically synaptic noise, and noise main signal will be always lost or it will be impaired. So that impairs hippocampal function and thus impairs learning capacity, and learning capacity means all process of memory I am talking about if it goes in elaboration. So this chronic sleep restriction and continuous multitasking, that one thing very difficult to achieve definitely at all level, and we should have active measures for it. But as a learner, we should tell student that while studying or while learning, avoid multitasking, checking the phones and checking the notification and other things. I maybe not always related to the phone, but mostly it is related to phone, as we all know. Now going to the sleep hygiene, definitely without it goes without saying that one of the major threat in this century is to our sleep. It is the blue screen, may it be a laptop, may it be a mobile, may it be a TV. So maintain regular sleep duration and timing, because physiologically slow wave sleep and specific sleep stages sequences are critical for replaying hippocampal memories. Replaying is a technique used by brain. I mean, that happens physiologically. It is not brain is using something, but that happens. So replaying hippocampal memories that happen during these stages, and strengthening or pruning, as Dr. Munira said, the pruning of synapses involved in new learning, that happens. Now, another important thing is what is told in traditional medicine also. Since ages we are talking about that, and now the chronobiology is talking about that. Do right thing at right time and consistently do that. So maintain your routines and schedule. Very important. Protect early night deep sleep and avoid post learning sleep deprivation. Very important. Two are different things, but both are mutually independent and important. That early night deep sleep is very important for the better memory consolidation and post learning sleep deprivation. कि आपने आपका टॉपिक पढ़ के हो गया, चैप्टर कंप्लीट हो गया, नाउ आई एम फ्री, आई हैव टाइम, सो आई विल वॉच some movie and then I will see few reels, but that few reels become 100 reels, and you don't know, you have almost lost 1.5 hours or more than that, and then that is not loss of time, but that is loss of the study that as a student you have done earlier, because its consolidation will be affected. So which disrupt hippocampal plasticity, increases molecular stress in hippocampal neurons, and impairs later recall. So ultimately consolidation is affected. So apart from maintaining routine, what is important, I again highlight, as early night deep sleep is very important physiologically, as we have evolved over a generation. We talk about that, few people say I am night owl or something counter to it. But if you say physiologically how we have progressed and how we have evolved, till we evolve to the really night owls, till that time early night deep sleep will be important for the better learning. Now coming to the physical activity, because neurons require oxygen and oxygen with good metabolites. So before physical activity, before nutrition, I mean physical activity comes, so we should engage in regular aerobic and interval exercise on most of the days of week. And such activity increases again at neuronal level, I am talking hippocampal neurogenesis. It boosts neurotrophic factors like BDNF and enhances memory performance. Even brief bouts of mindful interval exercise or that can be interspersed not only by the student during their study habit, but even during class, if they do or we make them do, that will improve attention, improve inhibitory control and other executive function that are important for learning. Then coming to the nutrition, yes, emphasize certain type of diets. So I don't say any type of Mediterranean diet or this diet or that diet, but we should again look back to our traditional diet, that whatever we are eating since ages and what is eaten in our family, not in the last, I mean, few decades, but before that, and what is advised by traditional medicine and what is feasible that you can manage where you are studying. So seasonal fruits, seasonal vegetables, whole grains, healthy fats, and limit ultra processed food that support synaptic function, that reduce a state of inflammation that affect all organs. So it will affect neurons and neuronal plasticity. So that will modulate glutaminergic signaling and relevant to that is for our learning. What we should avoid, that I have told what we should eat, but what we should avoid is avoid chronic high sugar. Now we all know that how much sugar we consume during day, high saturated fat diet, and that is again available. Whatever fast food that we are eating or as a student they are eating contain both of the things at high amount, and they are linked to impaired hippocampal plasticity and worse cognitive performance in scientific studies. Now last but not the least, mindfulness and mindset. Yes, as a teacher and as we should encourage this, and as a student we should train them to feel this, that regular mindfulness and meditation practice that reduces stress reactivity, and as madam told, Dr. Arunima told about this, that how it affects their learning. And this technique will help in reducing the stress and improve cognitive flexibility and modulate prefrontal and limbic networks that get plasticity and attention. So combining mindfulness with movement and exercise like mindful breathing during recovery intervals may give complementary benefit for attention and self-regulation for the learners. So overall, all these changes, that starting from the study routines, change in sleep hygiene, changes in physical activity and nutrition and mindfulness and your positive mindset. So if we combine all them together as a student and improve them, whatever you are doing or any component that is lacking, add all these things together, that is going to help the neuronal plasticity, and further that will help the learning process. Thank you.
Thank you, sir. Thank you. Right, you rightly mentioned everything should be
Madam, we can't
it
hear
is
you.
a very demanding profession, so we have to be very much aware, and we should teach our students at a frequent time. It's not like that we have to complete this syllabus and tell them, but we have to tell them repeatedly so that they adopt, because the Gen Z students are their lifestyle, their life requirement, their entertainment things are totally different from us. So we have to tell them what you just told. So thank you, sir. So my next question to all panelists. Now, there is no new thing that AI is invasion is in the healthcare sector and health education also. So the question is, AI systems adjust learning based on students' performance, similarly to how the brain strengthens or weakens synapses with experience. So, do you think technology can act like a digital form of neuroplasticity in education? My, I request Dr. Munira ma'am to throw some light on this.
So, thinking of AI as digital form of neuroplasticity, I rather think I would like to think of AI as adaptive teaching, or use of AI for adaptive teaching than for having learning when neuroplasticity. So we can actually use AI, and AI is a good teacher. Like someone had mentioned that we can use that for spaced repetition also. So AI can actually customize as per the learner's need what is required, plan the content as well as the repetition tests as per the needs of the learner. So I think we need to use AI for teaching and adapt. We ourselves as teachers should also use AI to get some idea and inputs so that we can address the specific needs of all learners. Thank you.
Thank you, ma'am. Dr. Chinmay, sir into gamification
Yes.
and all that.
Yeah. So here I would like to say two things. Number one, AI is there and it is going to be there. Okay. So everybody will agree that we have to use AI. But the thing is now, for example, knife is given to you. Now it's up to you. Are you cutting a fruit or cutting a life of somebody? So we have to use AI in such a way, I will use the word constructive way, so that student will develop a more learning. And for example, I have seen few of the students at our places that they have started using AI to summarize before the exam, because we on a lighter note, we caught one person just before into the exam hall, that why are you taking mobile and you have opened the chat gpt. He simply said that, sir, now we are not reading the book, we are using a chat gpt to summarize the things and then answer into the exam. So in such case, now as a teacher we need to learn that how we can leverage the use of AI and gamification in a way that we improve the memory and learning, rather than if we not use our brain and solely depend on the chat GPT, then disuse atrophy is going to happen. So we have to avoid that disuse atrophy and use AI in a constructive way, so that teaching will also improve and learning is also improve.
Thank you, sir. Dr. Arunima.
Yes, ma'am. Madam, your question was, I think, do you think technology can act like a digital form of neuroplasticity in education? Just as different students' brain develop different neural architecture based on their experiences, AI can theoretically create individualized learning trajectories that standard curricula cannot. AI systems adjust instructional strategies based on performance data. Neuroplasticity is a biological mechanism by which learning physically occurs in the brain. These aren't analogous processes. One is a teaching tool and the other is the substrate of learning itself. Neuroplasticity involves the construction of meaning through experience, connecting new information to existing schemas, emotional significance, personal narratives, and broader understanding. AI can present information, but it can't ensure students are building meaningful neuronal representations rather than superficial pattern recognition. From a psychological perspective, technology has limitations. While it can deliver content adaptively, It cannot yet provide emotional support, read subtle signs of students' distress, or create the psychological safety essential for deep learning. The best model is blended, using technology for knowledge delivery and practice while preserving human interaction for mentorship, emotional support, and complex clinical reasoning. We must also be cautious about screen fatigue and ensure technology doesn't replace human connection that make medical education meaningful. Thank you, ma'am.
Thank you, ma'am. Dr. Pradip, sir?
I will just put a different view in terms of whatever has said. I agree with it, but the another side will be now we feel that as Dr. Chinmay also said that student was doing with the help of Chat GPT before the exam. So we are now confident once we have mobile and live internet connection in it, and we have taken some kind of subscription. Now any question you ask, I have answer ready. So sometime if you see the biology or the process of the way we remember certain task, that's something that is difficult to learn, something that is first time you have understood, or something that is going to be useful for in future, and you will not have that content in front of you. But now having that mobile or phone with the internet connection, I mean the laptop in front of you with the live connection, then we get a false sense that it will be available in few seconds in front of me. So if that become a habit consciously or subconsciously, then I feel that it may affect negatively also the neuroplasticity. But yes, the evidence is not that great as of now. I'm just proposing it, and there are few evidences. People say use it or lose it is the law of nature. So if you stop using and getting information of whatever content you want so easily, because more difficulty you have in getting certain content more. I mean, if you are reading a book and you want to answer for something, and you have to go through pages and for going that line or particular answer, there is lateral learning, and that lateral learning is always contextual, and that help in long-term potentiation of the memory by increasing the synaptic plasticities. Now that is not happening. You are getting ready-made answer, and now that uh, physiological difficulty or physiological discomfort, I say, or eustress in other way one can say mentally, that is not there. So everything is available. So now your way of learning or way of neuroplasticity will change, and then that is negative side, I must say, of the technology. It has to be there, so we have to do or live with it, but we have to be aware also somewhere. Thank you.
Thank you. Dr. Arunima, ma'am, you said about personal narratives. So I want just in a few words or few minutes from each one of you, your personal experience about the student's feedback or student's preference. So we know, or research also shows that active learning strengthens the brain through long-term potentiation. But many students still prefer structure or teacher-led lectures because since from schools they are used to that. Changing students' learning habits or their comfort zone is a real challenge. So, what do you think, or what is your personal experience at your workplace? So, Dr. Munira, ma'am, please. Dr. Swapnil has raised a hand. So,
Madam, I'm Dr. Swapnil. I'm from Government Medical College, Vadodara, and I'm an associate professor. Active learning is based on the basic tenet of constructivism. So when the student learns actively, he processes the information, but knowledge is built brick by brick on top of the other brick. One brick is a chunk of information, that is information linked together by meaning. So I think long-term potentiation occurs only in consolidation of memory, and for that uh, during that time, active learning helps in constructivism. It helps in learning, but whether it helps in consolidation of memory, I am not sure.
Okay. So, Munira ma'am, your experience, please.
Yeah, so we are talking about active learning. There are two things when you learn actively. One is you are actually constructing that knowledge using your previous knowledge or activating the previous schemas. Someone has asked about questions of schemas. So when we are learning, our the way we store our memory is as schemas, and there are also physical traces and mental models. So both. So when we are constructing new knowledge by active learning, we're actually using the previous schemas, building upon that, and constructing new models or adding to those models and expanding those models. The second thing that we do in active learning is something which is social and which is participation with others also. So both these things help in learning and also converting it to long term memory. So whenever things are more organized, structured, they it is easier to encode it, and when things are encoded well, they move better to the long term memory. This is what is my understanding, Dr. Swapnil. Thank you.
Thank you. Thank you. Dr. Chinmay, sir, can you please just in a very short manner?
Yes. So I agree with what Dr. Munira said, that when we are doing an active learning, so as we have started with the neuroplasticity, when active learning is more going to happen, the rewiring, firing is going to happen, and definitely it is going to improve the learning and memory. So as I said previously, uh, that definitely it will help in the learning, and definitely it will also increase the consolidation of the different thought process, and finally it will result in the long term memory. This is my view.
Yeah. Thank you. Thank you. Arunima ma'am, please.
Yes, ma'am. Passive learning feels easier and more comfortable. So, what the researchers call as a fluency illusion. When information flows smoothly from professor to notes, students experience this fluency as understanding. Active learning feels harder, more confusing, more effortful, and the students interpret this difficulty as evidence they are not learning. But the cruel irony is that cognitive struggle that feel like failure is actually the neural work of LTP. The A's that feels like success is often superficial encoding and won't survive until the exam. So I have observed that students who initially resist active learning often become its strongest advocates, but only after they experience success with it and develop metacognitive awareness of why it works. The transformation requires they push through the discomfort long enough to see the results. Many never get past the initial resistance. The teacher's dilemma is educators who implement active learning often face student resistance that manifests as poor evaluation, complaints to administrators, or requests to transfer sections. The system punishes them for using evidence-based practices. This is systematically irrational, but individually very real. The brain is exquisitely adaptable, neuroplasticity, yet our educational system are profoundly rigid. We have created institutions that fight against the very adaptability they're supposed to cultivate. Thank you.
Dr. Pradip, sir.
Yeah, I agree with the previous speakers, and definitely active learning is what is very important in terms of neuroplasticity if we are talking about. When we say learning, that includes understanding and recall and retrieval also. Just learning and if you separate the learning from the performance or application in future, then things are different. Many things that we have learned, what we say in terms of learned in in our childhood, we understand their meanings in our younger age or maybe when we become adult. That माँ बाप ने ये कहा था या ये गुरुजी ने ये सिखाया था, इसका मीनिंग आज समझ में आके जाके आ रहा है. What is that? So have we not learned that thing? If somebody asks in exam, recite this poem or talk about this, so the level of assessment was that only, recall. So when we talk about synthesis, when we are behaving as an adult, it comes to, or when I am practicing as a doctor and treating some case of diabetes or maybe some case of fever, I may not have understood to the level of that level of application, but partial learning has happened as a MBBS student. But when I am applying it, the learning continues. But that consolidation that happened during that point of time, that knowledge was there. And when the active component was involved there, it has helped more. But maybe some passive component there that I was just to ratify it. That मुझे ये definition आनी चाहिए, बस मुझे बाकी पता नहीं है. I have ratified it without understanding or maybe partial understanding or maybe wrong understanding. But later on, I know the definition now, I apply it and now I can, oh, I correlate, yes, that was what has been said and now, yes, sahi hai. This is correct. Now I have experienced. So, yes, you cannot just typify them that whether the student-led, I mean, the active learning, or it may be, the traditional way of learning that they have habit since their first standard to the 12th standard. That is also changing now, and they are practicing both the things. So answer is we have to have both the things, and that will have their role in learning in different way. Thank you.
Yes, sir. You rightly mentioned education systems are changing. Still, ma'am, Arunima ma'am mentioned in our education system or learning teaching experiences still are in a way rigid. So, ma'am, my question to you is, if you want to redesign medical education using neuroplasticity and learning physiology as the foundation, which is the one element you want to change from current system? Just very quickly, one element. Arunima ma'am, please. Was my you are on mute, ma'am. You are on mute.
I would mandate psychological safety and mental health support from day one. Medical education is stressful, but much of the stress is iatrogenic, caused by harsh faculty interaction, assessment culture, and lack of support system. Creating an environment where students feel safe to ask questions, admit confusion, and make mistakes without immediately enhance learning. This isn't being soft, it's being neuroscientifically intelligent. A stressed brain cannot learn effectively. Thank you.
I want from Dr. Chinmay sir, being an administrative role and into innovative teaching learning methods, what will be your answer? Just if you want to change one element from the current system, what it will be?
Very pertinent question, and I think you all people may laugh on me, but as now we all have started following a technology as per the Western country, now we need to adapt our teaching learning method also as per the Western country. See what we can do, that if you go to any other colleges, now there is no more mandatory attendance. Okay, because of multiple reasons. Number one, all teachers are not teaching equally, and all students are also not equal. We have a fast learner, we have a slow learner, we have a medium learner. So if permission is given to me, I will make attendance non-mandatory. Routinely, I was discussing with the faculty that to bring student into the class is teacher's responsibility, and to grab a mark in exam is student. Let me repeat. To bring a student to the class is a teacher's responsibility, and to grab a mark in an exam is a student's responsibility. So it is up to teacher how he can take more and more student. So student is only going to come, he will enjoy. Otherwise, he will not come. Otherwise, all are sitting, boring, doing means in physiology, they are writing histology journal, in anatomy, they are writing biochemistry, practical and all that things are going on. We all are aware of it. So upfrontly, I am telling that this biggest change I will make, that attendance is non-mandatory. If you want to come, come, otherwise not. Yes.
Thank
But
you, sir.
simultaneously,
Yeah, sorry.
but simultaneously, definitely I will make exam standardized. See, sometimes we think that, okay, this is the fourth trial of my student. Let us pass them. So that thing should not be happen. So once we are putting a learning responsibility on students' shoulder, assessment comes to our shoulder. That our assessment should be fair. And those who are reaching up to the mark, they get pass. Otherwise, they have to read in whatever way they want to read. So this is the two major changes: standardization of the exam and non-mandatory attendance. These two changes I will make. Thank you.
Thank you, sir. On a lighter note, when you said it's a teacher's responsibility, I am suppressing my urge to take a poll on this. Just Dr. Pradip, sir, you are see.
After such a great remark by Chinmay, it's interesting. I must say, on the philosophical side, now I'll answer rather than going to this thing, that until and otherwise we increase morality and ethics within us, nothing is going to help us. I mean, that culture, I mean, not one person, that what we call as a organizational psychology, that why we are here, what is our aim, what are the purpose for the study, what is purpose for teaching, and why I am having a job of a teacher. And then simultaneously coming back to the real world, that if I don't do this, my next promotion will not be there, or if I don't do that, I will not pass and get distinction in physiology or anatomy. Then those are not like matching, and that attendance is just one thing in that, as Dr. Chinmay rightly said, if the one chance is given. So chance is given, definitely I would like to ensure the great organizational culture enforce in may sometime if required, because until otherwise something is that is valued from top to bottom. I'm not saying just by the student or just by the teachers, by all part of the system, because what we are living in today's world is called as traumatic de-idealization. What we read and what it's told to us, we see around us contrary example to that. झूठ नहीं बोलना है और सामने हर कोई झूठ बोल रहा है. So that is the problem. Then we say no, झूठ नहीं बोलना है, this is not correct. झूठ बोलना चाहिए, सब काम हो जाता है फिर आराम से. So then morality, what ends lie down is the morality. So if the morality, we do something as a teacher or as a system, not only teacher, because many of us are part of the system also, like now Dr. Chinmay is dean there, right? So we have some way of, in our small capacity, we have to start somewhere and do some active steps in changing this importance of morality. If we as a teacher play this role, it will be contribution to the next few generations. I mean, not immediately we can reap their fruits. Thank you.
Thank you.
Just I would like to add one thing.
Yes, sir.
In continuation of what we are discussing, neuroplasticity, we are discussing for teaching and learning and memory. So I don't know it is feasible or it is okay to discuss at this point also. But I think there's now emotional plasticity is required, which is missing now. As we are discussing regarding stress, we are discussing regarding this suicidal tendency and mental trauma and all that thing. Emotional neuroplasticity, I don't know that I'm using correct word or not, but that emotional neuroplasticity is going away. And I think at certain part, our families are responsible, and at certain places, our teachers are responsible. So rightly said by Dr. Pradip, that culture, organizational culture, अगर बायोमेट्रिक है कि नहीं है, टीचर 7:45 को पहुंचता है कि नहीं, 8:45 को पहुंचता है कि नहीं, is organizational culture. Otherwise, in small cities, biometric happens at 7 a.m. in morning and 9 p.m. in the evening. Okay, so maximum time they are in the institute, and we know the reality. Okay, so yes, Dr. Pradip, organizational culture and emotional plasticity, I think, are two things we need to.
Yes, sir. Yes, sir. You rightly mentioned. As we are coming to closing the session, just to sum up what we heard for the last one and almost a half hour. So, just a rapid fire round. We'll start with Dr. Chinmay, sir. So, sir, it's like a basic questions. So, neuroplasticity in one sentence.
Okay. It is the brain's ability to change and recognize itself through a new neural connection in response to learning.
What changes faster, structure or function?
Mm, I think its function, synaptic strength changes within hours, while structural takes some more time. I think it from days to weeks.
Okay, one neurotransmitter is most associated with learning.
There are a lot many, but just if you want to give one
Just
example,
one.
it is a dopamine, which
Okay.
reinforce the reward-based motivation.
Okay. Practice or talent, which matters more for memory?
बहुत सालों से बोला गया है, practice makes me perfect. On the
Yes,
lighter note, I
yes.
don't know about others.
One myth students should stop believing about the brain.
Constantly, it has been bombarded to us that we use only 10% of our brain, and these scientists has used this much, these scientists has used this much. So that is the myth which don't need to be bust.
Yeah. Coming to Dr. Munira, ma'am. Ma'am, just a rapid fire. Lectures or active learning, which is better for brain wiring?
Active learning, I think we have already discussed,
Yes,
and in
yes.
the chat also, active learning. And that is something that I would like to change in case I make a change in the system.
Yeah. Oh, I think I forgot to ask you.
No
Yes,
problem.
in the flow, I forgot to take your opinion. Sorry for that. So,
No issue.
most powerful teaching tool backed by neuroscience.
Retrieval practice.
Yeah.
And that is the second thing. If Chinmay is removing attendance and putting the onus on the exams and testing and structuring it, then more of retrieval practice, more of testing, more of feedback.
Yeah. One feedback rule that improves learning instantly. So,
Something
how
which is
should be the
specific and which is something which can be acted upon.
Yeah, yeah. Should teachers know how the brain learns? Actually, we know, but how we explain or reinforce with the students, or maybe frequently tell students.
So I think what we do is we know the good practices, like we know that we need to recap, we know that we need to summarize, we know that we need to use MCQs or scenarios, but many a time we don't connect that with the processes. So if we do connect it, of course, we'll be able to plan our sessions more meaningfully. So we
Yes,
should know.
yes. One change medical school should make immediately. We are taking courses in medical education,
More
and
of
still,
active learning.
yeah,
Means
yeah.
less of lectures and active learning. And one thing that I would want students to change is move from that exam oriented rote learning or cramming, one day
Hmm.
before the exam they learn, they get good scores also, because our examination is not really testing application, it's testing only maybe recall. So they do get good scores, but that doesn't correlate well with their actual knowledge. So maybe that is something that we should change.
Yeah, thank you, ma'am. Dr. Arunima, ma'am, for you, the
Yes, ma'am.
question is, which emotion helps learning the most?
Curiosity. It
Okay.
activates dopaminergic system and depends attention.
Which emotion shuts learning down fastest?
Anxiety.
Hmm. Yes.
Elevated cortisol disrupts hippocampal memory processing. And this
Okay.
is how it works.
Yes. Stress or curiosity, which shapes the brain more? Either positive, negative.
Stress negatively impacts it, and curiosity positively impacts it. Both leave lasting neuronal signatures.
Okay. One classroom action that lowers stress immediately.
a psychologically safe environment where mistakes are treated as learning opportunities.
Yes, ma'am. Can kindness be a learning strategy?
Yes, empathetic teaching enhances emotional regulation and function.
Okay, thank you, ma'am. Dr. Pradip, sir, one study habit that builds the brain fastest.
Yeah, as one thing has been said by Dr. Munira, spaced practice with periodic self-testing is another thing that can be done.
Yes. One myth about learning students should forget.
Yes, if they are struggling, that they feel they are not smart than others or they are lacking behind others. Actually, struggle is evidence that brain is growing and they will perform.
Yes, sir. Yes, sir. IQ or mindset, which matters more?
Mindset always, anything that you believe, you will be able to achieve it with more effort and it will help in plasticity.
A brain-friendly study routine. You mentioned, please.
Yeah, practice, reflect, and get good sleep and at timely sleep.
Yes. One thing students should stop while studying.
That we all do, not only student, multitasking. We should stop multitasking while studying.
Yes, 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 sir. So, this is the closing round for all of you. So, one sentence from each of you. What is the one fact about the learning brain you wish every teacher and student should understand? So, starting from Munira ma'am, please.
So maybe the first thing that comes to my mind is something interesting that I learned when I was reading about learning and memory, that our working memory is very limited. So it's very important that we as teachers, when we are dealing with presenting information, we really look at how much information we are giving at one time and reduce the amount of information present in the visual mode and supplement it with the auditory pathways. So you use the combination and reduce the information presented at one time and slowly build upon it. Thank you.
Yes, thank you. Dr. Chinmay, sir.
Make learning interesting.
Yes, sir. Yes, sir. Dr. Arunima, ma'am.
Emotion and cognition are inseparable, and you cannot optimize learning while ignoring students' emotional states. A curious, safe, motivated student will learn exponentially better than an anxious, stressed one, even with identical teaching methods. Teaching is as much about creating the right emotional environment as delivering the content. Thank you.
Dr. Pradip, sir.
Yeah, avoid multitasking and sleep well.
Yeah, thank you. Thank you. So, thank you to all our panelists and thank you to our audience for your engagement. Let us carry forward one message that every teaching moment and every study habit changes the brain. So, let's design education that respects the physiology of how humans truly learn. So, thank you for everyone, participants, and our esteemed panelists. And now we conclude the webinar. Thank you, everyone.
Thank you, ma'am.
Good night. Good night. Hope
Thank
you
you all.
enjoyed.
Thank you, everyone.
Yeah, thank you.
Thank you. Thank you very much.
Yes, thank you.